Not everyone knows that hearing loss is prevalent, about 3 in 1,000 babies, and that as we age, more and more of us have trouble hearing. And not everyone knows that listening and talking is an option for even those who are born deaf. Hearts for Hearing gets the privilege of raising the awareness, not only in our state, but in our nation and worldwide, about what outcomes are possible.
I love the mission, and I love the outcomes that we're able to achieve for our entire patient population. We are one of the top hearing healthcare organizations in the state and even in the country. We are becoming known beyond our borders.
Every baby should have a newborn hearing screening before going home from the hospital. Ideally, a baby that does have hearing loss would be diagnosed with hearing loss within the first month of life. That's our primary goal. Beyond that, we are monitoring the hearing loss to make sure that it's not changing at all. And we are pursuing intervention, whether that's hearing technology, if that's appropriate, setting them up with early intervention, whether that's listening and spoken language, or if it's another mode of communication, we have community partners that we'll refer them to. And so really the idea of diagnosis by 1 month, technology by 3 months, and then kind of on their way and intervention by 6 months. If we can identify early, give them access to all the resources that that family needs and walk alongside them in that journey, they'll do great. They can do really great things. We have the technology available to us to allow that child to learn to listen and talk and to enter into preschool with their peers.
It is our goal that everyone who steps into one of our facilities will experience excellence. Our patients and their families can trust that they will receive the same level of care across our organization, from the front office staff to their providers.
I am so joyful that I get to see babies who are a couple weeks old, and then I see cochlear implant patients all the way up into their 90s. And they are able, in the same building, to just walk down to the audiologist's office or walk over to the physician's office and have those in-person real-time conversations so that we can come to a solution. We're able to just really streamline that for the families.
We are developing systems, applications, and other items that we're going to be able to share with those in our field that I think will help project the field of hearing healthcare and listening and spoken language further. I think that we all have the same goal in mind, and that if we can work together to achieve the best outcomes, that's the end goal.
You know, there are little ones who it's not easy to tell their families the diagnosis, but it is easy to know what the potential is and to guide them and to walk alongside them in that journey.
We're changing people's lives on the daily, whether it's babies, caregivers, grandparents. We're able to give them the gift of sound and make that meaningful for the rest of their life. I think Hearts for Hearing is here for a long time. So I'm looking forward to seeing the continued growth, whether that's what we can predict or things that technology brings us that we get to work with in the future. Hearts for Hearing is here for a long time.